the different types of induction methods. And I do go through this in the course as well. So when you get to that part, it'll just be a little bit of a refresher. For those who have already watched it, that's great. You probably are getting a refresher from this. But there's a few different ways to be induced. So a stretch and sweep is kind of the most, I don't know, the least like medical way of starting an induction. And basically all it is when they're actually doing an exam to check your cervix, if you are at least 1 centimeter dilated, so basically the tip of the finger, they can actually go into the cervix and kind of do a little bit of a sweep around. And what that does is actually separates the water sac from your cervix, which releases prostaglandins. And that is what another induction method is giving artificial prostaglandins. And what prostaglandins do, if you have looked at it in the this part of the course, it's actually responsible for softening and helping thin your cervix. So they're really important and they're really effective. So what you find with these 3 different kind of medication ones that we just talked about, they all act on actually working on your cervix first. So that is the first step in induction, is you have to have a favorable cervix, which means that it's softening, it's shortening. So again, like your cervix starts at about 4 centimeters long and it goes down until it basically is not there. It has to thin out. So from 100%, they say, which is like, I don't know, it's a fairly substantial muscle. So when it pulls away, it basically thins to the point where it feels like not much more than a piece of paper. So they call it Paperthin or 100% effaced. I go through this again in the labor section too, so it'll be another recap for you. But once your cervix is starting to have those changes, and you might notice that you lose your mucus plug, that will probably come first. You might get what is called bloody show, which is when it's basically some spotting. It might be kind of streaked. It's basically just blood that is coming out because there's tiny, tiny little blood vessels in the opening of your cervix. And as it thins and stretches out, then they just kind of pop. And basically, once you start seeing that bloody show, then that means like, you know, your cervix is changing. So a lot of people do actually get quite excited. The mucus plug you can be losing actually for a couple weeks. Some people don't. Some people just lose it for a very small amount of time, like a few days or a day, and it all kind of happens at once, but you can actually regrow the mucus plug. So it's not really as sure of a sign that labor's starting as if you're having the bloody show.